This episode of the Bari Chronicles is proudly brought to you by Bariatric Support Australia.
Hi everyone, I'm Tash.
And I'm Damo.
And we are so excited to bring you this week's episode of
The Bari Chronicles.
Damo, this week, our episode is titled The Bari Sandwich.
I like sandwiches.
I do too.
Is it that sort of sandwich?
No, it's not. It's not that kind of sandwich. It's the kind of sandwich that you have when you're delivering things that can sometimes be problematic. But we like the bit in the middle.
Yes.
You know? So we thought we would call it the Bari Sandwich because it was a little bit more PC than things that piss us off.
Yeah.
Do you agree?
We've got to sort of poke our way through the crust.
We do. Just poke, little bit by little bit.
I agree.
And we don't... Sometimes it's really interesting when you're part of an amazing and incredible online support community, and there's people that are new to the group, or there's people in there that don't actually realise that you're the people that host the Bari Chronicles. And it's really interesting and very good for us to be able to get feedback from people that don't realise that we're the ones that host this little podcast. And we don't ever want to come across as only talking about the scary things about bariatric surgery or things that aren't that great.
Yeah.
Because there is so many things that are wonderful. So many.
Yeah, there are. I mean, it is life-changing.
Yeah,
100%.
And
for many, many, many thousands of people, they go on to live happy, fulfilled.
Many
years.
Yes.
And I think that's important to talk about as well.
It really is.
So often we get lots of questions about the scary things, the complications that can happen, and
that's normal, right?
Yeah, I think that's important to understand that things do happen.
Yeah,
and I think it's even important to understand that it can be beneficial to leave banking details and all sorts of that with someone that you can trust, that if you're in hospital a little bit longer than you're expecting, that bills and everything can still be paid and all that. But I also love the stories where it's the dream run.
I absolutely love that too.
Yeah.
I was talking with someone during this past week, and they were saying to me how they'd been really, really scared. They sent me a DM, and they said that they'd been really scared about all of the what ifs, all of the things that can and sometimes do happen to people, but how their run has just been so smooth and so easy to now. And I love that. I absolutely love it.
Yeah.
I think that there is nothing more encouraging and exciting. And I even think, and this is what I often say, if people message me directly, I say, don't look for the problems. Expect that bariatric surgery is going to answer those problems for you, that it will be something that is just great and wonderful in your life, and go into it with that sense of expectation and excitement. I mean, also don't go into anything like that, a massive life-changing surgery and a huge decision, just willy-nilly. Understand everything, but I think it's really good to just expect the best.
Yeah.
Because the vast majority of people, that is what happens. You decide to have the surgery, you slide on into pre-op. Hopefully it's only 2 weeks.
Yeah.
Because if it's not,
after, yeah, for me 10 days was sort of pushing it.
God. Yeah. But I think that you and I just have a weird reaction to the shakes.
Well, I mean, we grew up doing shakes.
We did.
You know,
Every diet under the sun. Not because our parents wanted us to be doing the whole diet thing, but because the doctor was saying, hello, you need to do something with your children.
With your piglets.
Yeah. Well, with your, your obese children. So, poor mum. Poor darling. She spent years and so many years of her life worrying and fretting and trying all different kinds of things because, we needed to be.
Because doctors didn't understand it.
Yes. But as I was saying, slide on into pre-op, do that pre-op. If you're going to have a food funeral, maybe do it before you start pre-op. My whole life, I've said this a lot of times, my whole life was a food funeral before I did pre-op. So I didn't do anything like that. But, for those that want to do that before pre-op, get in there, get your pre-op done, you go in, you have your surgery, and our surgeons in Australia are very skilled and they should be performing a really safe and excellent surgery that does the job. And, you then have your stages of recovery and then you're off. And, 12 months later, you can expect that your life is just completely transformed.
I think that's something that is important to look at. One day, we have the surgery and, things can be up and down and our emotions and all that gets thrown out. But one day you wake up and you realise that you haven't actually thought about it for maybe a week or more, and you suddenly realise that you've reached your new normal.
Yeah, that's right. That's right. You do. You reach a new normal. You come to a point where you go, I'm okay. I didn't starve. I was sure. I was sure. I remember ringing you. I was about 3 weeks post-op. And I remember calling you because we did not live in the same state at that time. And I was literally panicking. I was like, is it normal that I can eat like 3 teaspoons of food and then I'm full and I can't eat anymore and I feel like I'm going to actually starve? And the scales aren't moving though. So does that mean I have to have less? And old mate here just says, good things take time.
Such an asshole.
All of that weight didn't go on in one day, so it's going to take a bit of time. It's like...
It was like when I had my surgery and went to a function like 2 weeks later and someone came up to me and said, oh, I thought you were having weight loss surgery. I said, yeah, I did. Well, how come you're still fat? And it's like, thank you, motherfucker. It's like, they don't.
Who are these people?
Hook up a vacuum cleaner and suck it all out. I wish they
could. If you're listening to this and you're a support person, they are really good things to not say. This is part of that sandwich thing. So at the moment, this is the bread. This is the stuff, like that we don't love, but we have to have it because it holds the good stuff in place. Be the awesome support person. Be the great one. Be the one that's there championing the person that's had the surgery. Get all the information that you can about what they're going through.
Yeah.
And be there to support them. I mean, I was very aware that it wasn't fair for me to expect my whole family to start suddenly eating like me. I was also very aware that it was going to be a massive change, but I didn't really understand how big it was going to be until the first time that my family brought KFC home, and then I cried in the corner, literally. I think that it's really, really important to remember that while we want our support people to be there for us, we can't actually expect them to change everything about themselves just because we're doing something different.
Yeah.
And that is one of those things that is a little bit of a shit sandwich
Mm.
because, I don't know, I think sometimes we can have some expectations around how we think people will be with our surgery. And then there's how they actually are with our surgery.
I mean, we want people to notice. Generally, we want people to see that we're losing weight, that things are improving for us. And I know it can be really confronting if you go to a function or something and no one says anything.
Yep.
You walk in there going, I feel like $1 million. I might have dropped 3 clothes sizes or something. And you walk in and no one says anything. And that's really confronting. But then at the same time, it's really confronting if they go, oh, well, you're still fat, or, oh, you've got loose skin now, or, it's a sort of two-edged sword, isn't it? If we're open to people saying things to us, we can't control what people are going to say.
100%. Steve actually, Steve-O is the husband of me. And Steve said to me one day, because I don't know, I think I'd probably lost about 50 kilos at that point. And we were out and we'd seen people that hadn't seen me for probably about a year. So I definitely looked totally different. And I was kind of hoping that, like they might at least say something. And they didn't say a word. And Steve said to me, what do you want people to say, really? Polite and, nice people just say, oh, gee, you're looking well, because we don't want people commenting on bodies. So isn't that good that that's what they said? And I was like, screw you and your logic. Shut up.
But
it's true.
Yeah, it cracks me up because it's true. No one has the right to go up to anyone else and say, oh my goodness, you're looking fatter than ever. Or,
that's exactly
making those sorts of comments. And we're trying to teach people, and, our kids are very good at it, that we don't judge people based on appearances.
Or comment
on appearance. But it's like, oh, I don't want you to say anything bad, but I want you to comment to make me feel better or make me feel good.
Like, to hype up the fact that I've lost a lot or something. So that's one of those, that can be a real challenge.
Yeah, it's a hard
in our Bari sandwich.
Although a funny story about that, I got to a point where I'd lost about 70 kilos and I looked so different. And Kim and I went to Bunnings to get some stuff. And I'm walking along with Kim, and these people that we knew them and we'd known them for a couple of years, they hadn't seen us for about 6 months, went up to Kim and said, oh my goodness, I'm so glad you're not with Damo anymore. Who's your new partner? And Kim just looked, and for me that was really hurtful because I'd been kind to these people and I'd worked with these people and I was just like, what the fuck?
Wow.
And Kim just she shut him down. She said, why would I leave him?
We do love our Kimmy. Like, Kimmy is one of the kindest, nicest people. She's like kind and accepting of everybody. She's taught me a lot about that. But holy crap, if you cross her,
she can be a bitch.
Cross her, wow.
Yeah, especially when it's
they
about someone
feeling brave that day or something.
Yeah, when it's someone she loves.
Yeah.
But
who says that?
But who says that to anyone?
Don't be that person. Don't do that. That's awful. That's awful.
I mean, I remember getting out of the car one day and a relative saw us and she went up to Kim and asked, who that guy was that got out of the car. It was me. So this is coming from someone who was related to us. And it's a real mindfuck when those sorts of things happen. And it can be by that point, I think I'd learned to take things like that as a compliment, even if it was a backhanded one.
Yeah.
Because otherwise I would find my resentment building. And
do you remember that phase, the resentment phase?
Yeah.
I started feeling that probably at about 5 months post-op. I think I'd lost enough weight by then that opportunities were opening up for me, things were opening up for me, people were starting to treat me quite differently. Friendships were changing, all sorts of things were happening. And I felt this overwhelming sense of resentment.
Yeah. Because if I'm good enough
I was
now,
still the same person. Yeah, exactly.
Yeah.
Suddenly, because you're 10, 20, 30 kilos smaller, people's perceptions and the way that we're treated can be quite different.
Yeah. And then there's the gaslighting, though, that comes with that, because if you're talking to someone about it, and I've heard this so many times, oh, well, maybe it's not them that's changed, maybe it's you and your attitudes, but you know what? When there are people that you sort of interact with on a regular basis that don't speak to you, and then they come up and engage a conversation, it is because their fucking perception has changed and that they were a judgmental asshole because I was living in a bigger body and they obviously didn't approve of that.
Yeah.
Not everyone is just well-meaning and
some people
misunderstood.
do have, unfortunately, even in the year 2024, people do still have and live with prejudice, even if they don't say it.
Yeah.
And I know that I went through that resentment phase, and in order to come out the other side of that, I had to do very similar to what you were saying, Damo. I had to start playing some games in my head and just not allowing those things to worry me, taking things as a backhanded compliment, as you said, things like that, like just taking all things concerning weight as a positive, because I knew that I was working hard. I knew that I was making changes, and what other people thought of those changes really isn't my business anyway.
Yeah.
And in the grand scheme of things, does their opinion matter?
I think that can be a really almost a dangerous thing, is when you're expecting someone's congratulatory opinion, but they're not saying anything. And sometimes we can sort of push for them to say something, and then we get upset when it's negative.
Yeah. I think it's, I think that's probably where, and it was definitely right around month 7, month 8 of the first year, when I realized that I really needed to start to work on myself, on my perception of who I am and what makes me me, and why I am worthwhile, worthy, valuable, all of those things, and not allowing what other people say about me or their opinions of me to be the things that shape me.
Yeah.
Or shape who I believe that I am. And that is something that I gave over for such a long time to others. I wanted their approval, so I would do things. I wanted them to think that I was worthwhile. I wanted that kind of acknowledgement. And it set me up for a lot of really harmful and unhealthy kinds of things in my own, like, inner life, I guess, in the way that I perceived myself. And I wanted that affirmation and that validation from others in order to feel like I was okay. And it wasn't until I realized that, girl, you can give that shit to yourself.
Yep.
That things really started to change. because losing the weight, the surgery will do that. The surgery is going to do that for you. And, of course, we can do things to maximize that. We can jump on board with, with healing our relationship with food. We can jump on board with healing our relationship with ourselves and working on ourselves with a psychologist or with a psychiatrist. We can set up some really great habits around ourselves, to do with our eating. We can utilize the services of great dietitians, and we can use exercise physiologists and get ourselves moving and doing all of those things. But unless we actually learn how to care about ourselves and how we work emotionally and set ourselves up like that, then ultimately we end up repeating all of the things that we've previously done.
Yeah. Because the weight loss and the surgery isn't the cure to the way we're feeling at the moment.
No, it's not.
There is a whole other side of it, and so often
we think it will be.
Yeah. I think, once I get this weight off, I'm going to feel so much better. I'm going to be more active. But it can be so easy to be 80 kilos down and you're still not running the park run or things like that because you're waiting for something to come and move you. And
for that validation that it's okay to go out and live your life. And I'm just telling you from my personal experience, if I was waiting for someone to tell me, I'd still be waiting. We have to just tell ourselves. And that has been a really challenging thing to do.
Yeah. I think I realised that, with my many back surgeries.
Yeah.
And each time I was waiting to not be in pain anymore.
Yeah.
And if only I was not in pain, I could go and do this or that, until I finally realised that, okay, this isn't going away. And I'm missing out on, going to the park with my daughter.
Life will keep happening.
Doing things. And I realised that, well, I can either be in pain lying in bed, or I can be in pain down at the beach, or, going for short walks, or, doing things.
Yeah.
And so I had to decide, okay, I'm going to get up, I'm going to do this. And, there is no big lightning bolt that hits you and suddenly you're empowered to do it. I wish there was, but
you already have everything that you need inside of you. And it's just a case of understanding that the knight in shining armor that you're waiting for is you, and you get the fuck up and you actually start taking those steps yourself. And you know what, like by having bariatric surgery, we put ourselves in an optimal position to be able to make incredible life-changing choices. The path after it, like we said earlier, it can be amazing. It really can. But there are some things that I personally have found that have not been amazing. I dropped my phone. I'm going to reach down and get it. I'm back. Oops, babe. I think one of the most challenging things for me is my little battle with dumping syndrome. I hate it. And it has been my old friend these 6 years. My first episode of it was the day after my surgery. And while I eat the foods that I know will avoid causing me to be in that position most of the time, sometimes I wish it would go away, but it hasn't. Now, this is that point where we have expectation versus reality. I expected that I would not have that. I do have that. Does it mean that I wish I hadn't had bariatric surgery. No, it does not mean that at all. It just means that it is something that I manage, something additionally that I manage on a daily basis. So for those that are listening, if you're weighing up about the surgery, but you've heard about dumping syndrome and what is that, and you've heard that people can have reflux, and you've heard all of these things, I can say we were actually looking at a complication list right before this podcast, and I think I had nearly all of them. I had nearly all of them, Damo.
Yeah.
Have had or have nearly all of them. I would still jump up on that operating table knowing what I know now.
Yep.
I would still do it. 100%. Has it been a challenge at times? Yes, it has. Is it difficult sometimes? Yes. It is not all unicorn farts and happy rainbows, but, and this was an interesting thing. I was actually at the doctor yesterday because I've had some, just had some difficulties with a couple of things, and I will be talking in upcoming episodes about the things that I'm facing and what we are looking at doing to rectify those things. So I do have some complications as a result of my bariatric surgery 6 years ago. But I was at my GP, and my regular GP was booked out, couldn't see me yesterday, but I needed an updated referral before I see my bariatric surgeon again next week because mine had expired. And I went in, and the doctor looked at me and then looked at his notes and looked at me again. And he was confused. You could tell. He was just confused. Because apparently in my notes, it said that current conditions were that I have asthma and that I'm morbidly obese.
Wow.
Yeah. So he was looking and he said, "You're definitely not morbidly obese." I said, "No."
It's like, thank you for that observation.
"No, I'm not morbidly obese." And he was just, and he looked at me and he said, "Congratulations. You've added 10 to 15 years to your life." And I just went, "Thank you." But I went home and I bawled because I thought, wow, even with everything that's happened, even with all of the challenges, like the reflux, the late dumping, the things that I'm facing at the moment, all of the other, like malnutrition, malabsorption, blah, 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 I am still that much better off for having had bariatric surgery.
Yeah.
That is the power of bariatric surgery.
But isn't it crazy that it's still on your record as a current diagnosis?
Yep.
Morbid obesity.
Yep.
Like, can we never drop that stigma?
And the funny thing about that, Damo, is that it's been there on every referral that's been sent to every specialist.
Yeah, so specialists go
And I've
read
never
it and
noticed
go,
it.
oh, we've got someone suffering with morbid obesity is coming in, and then you walk in.
Yeah, I mean, I got asked, "Are you sure that you are you?"
I don't know how I feel about that. Like, is it that hard to update a record?
A record, yeah.
Or is it something that they do leave on there?
Yeah, or maybe it's... Yeah, I've been kind of doing that as well. Like over the last 24 hours, I've been wondering, and maybe we can reach out to some of our medical friends and ask them if it's handy to know that as part of the history.
Because I don't know.
But it actually said current.
Yeah.
It said current on it.
Yeah.
I was like, wow, okay. But the fact that I've had many referrals to different specialists and I've never picked it up before. Wow. Like, I guess that just shows that it's just been so much a part of who I was that I never even thought to question, hey, like it says that about how I am right now. Strange. Very strange.
Very.
But also really, really empowering what he said when he said, and then, he asked what the plan is forward and what the diagnosis is, and I shared that information. And he said, well, even with all of that, you've still added 10 to 15 years to your life. You'll be around 10 to 15 years longer to love your family. And I was like, yep, that's
Amazing.
right. That's right. So worthwhile,
I mean,
guys.
that's the sort of affirmation that we should want.
Yeah.
Is something that is truthful, that
it's honest.
And it's coming from a medical professional that you've never really met before, but going, oh my gosh, this person has done something so incredible.
It was, I guess for me, it's the kind of, it was the kind of affirmation that I didn't know that I needed. I didn't know that, I didn't ever expect to get it. That was for sure. But when I did, it really did make me stop and think, yeah. Because it has been a freaking shit show here. It's been challenging, hasn't it?
Yeah.
Like, we're going through something at the moment with our mum, aren't we?
Yeah.
And,
and, even with that, one of the first things that gets brought up is weight.
Yeah, neither of us are probably, ready to talk about that openly, but yeah, weight was, and
as soon as that was mentioned, I saw red, because
if you want to trigger the room,
go there about someone's weight when they're there for something completely unrelated
to that.
And I was laughing yesterday.
The rage, the fury, like Damo and I both in the room, and weight is mentioned.
Yeah, we both. I was laughing yesterday because I was thinking about all that, and I was thinking how confronting it must be for doctors when that comes out of their mouth and it's done in front of us, who are more than happy to advocate.
But we didn't. I was actually really proud of us in that situation.
We didn't start yelling or anything silly like that
at all.
But
we would never do that.
No, we asked the question that is the reference to weight an issue because it affects potential treatments?
Yeah.
Or is it because of a weight bias? And it's okay to ask those questions.
In a kind, respectful way, so that we can understand. Yeah. So we can gain understanding. It's still incredibly triggering to hear it.
And with our mum, she very much wanted us involved with that. She has anxiety and that sort of stuff. So, she'd also asked us to be there with her and navigate this. So, I think it's important that we do that advocation for ourselves, for other, for our loved ones if we have to. But it's okay to ask these questions from our GP. Is this something that is going to affect me long term?
Yeah. How does this look? What does this look like in 5 years, in 10 years? That's very much where I'm at with the diagnosis that I've been given.
Yeah.
It is very much a case of, if I was to continue doing what I'm doing right now, could I put off future surgery for 6 months? Could I put it off for 12 months? Would that be a reasonable thing to do, or is that not a reasonable thing to do? And it is okay to ask those things. I would actually actively encourage us to ask. I would encourage you to ask those questions of the medical professionals that are in your life. Make sure that you fully understand exactly the ramifications of the decisions that you're making as best as you can. Yeah. And obviously they can only tell us with the information that they know to be true about the situation. And that's always very important to remember as well.
I recently had a full set of blood tests done and some different scans and that. And the blood tests, they came back that, my vitamin D is low, which a lot of people, it is low because, especially in Australia, we're told to be sun smart, so we keep out of the sun more than what, we once would have. And depending on the climate and everything, but my vitamin D was extremely low, and then my cholesterol's been up, which on this journey, we do things that we think, oh, this is going to be healthier. So, eating more proteins like shellfish type stuff, I didn't realize, but it's extremely high in cholesterol. So I'm readjusting my diet at the moment, and my doctor's going to check in another 3 months. We'll do some more blood tests and see how my cholesterol's going. But then if it's still up, we'll look at medications and all that sort of stuff, because I think that is the result of living with obesity, is that there's always going to be things that I need to get checked for the rest of my life, because obesity is a disease, and it's treatable but not necessarily curable. And so, we need to understand that, the surgery isn't
I really like
a quick fix. It's not going to fix us. It's going to help us get our health back.
Yeah.
But
give us
we have to keep going back for checks and tests. I remember Steve had to have that sunspot cut out.
Yeah.
And
a melanoma.
A melanoma. And then he has to go back for checks very regularly. With obesity treatments, it's like, oh, you've lost 50 kilos, okay, off you go, be well. But obesity isn't something that disappears just because we've had surgery. So, I think that's something that we need to understand, and I wish more surgeons and professionals would stress that to their patients, that, this is not we meet once or twice and then you're on your way. There should be some sort of responsibility taken when they undertake a surgery like that they're committing to treating this person for the long term.
And I'm incredibly fortunate in that regard. Earlier in the year, when I ended up in hospital, I was surrounded by brilliant teams. My bariatric surgeon found out that I was in hospital at about 9 o'clock at night, and he was in my room by 7:30 the next morning.
What?
So, and that's 6 years ago. 6 years ago, I had my bariatric surgery. That's the kind of professional that we all deserve to have.
Yeah.
And even though I've had complications, I believe that it is probably it's a me thing. I've always been that person, and we're still working out, if there could be some other underlying things involved there. Yeah, it's just so important to understand that in order to, have that yummy, good filling in our sandwich, it's important the type of ingredients that we put in there, and living the very, very best, most healthy life post-bariatric surgery means having all of our little ducks in a row. It doesn't mean that we never eat foods that are higher in nutrients ever again. It doesn't mean excluding things. Actually, I believe that's pretty harmful. It should mean that we learn how to navigate our life in a really holistic and whole type of way.
Which also means that if we don't get to our goal weight, that doesn't necessarily matter if our life and our lifestyle has improved.
I would go further than that, Damo, and I would say that goal weight is irrelevant if we are well, healthy, and able to do the things that we're wanting to do.
Yeah, definitely.
Because I think that while ever we become fixated and focused on a number, that can become something that defines us.
Yeah.
And we can feel very pressured around that. I mean, of course, we understand in some instances we for whatever reason we may need to be mindful of numbers. But I personally try to avoid them, as you know.
Yeah.
Yeah, just for, for my mental health's sake. I found that works really well for me. And I try very, very hard to make sure that I'm looking at my life in a holistic way, not just looking at calories, or not just looking only at macros. I mean, they're a great framework to use to build your food life so that you have an understanding, because I didn't have any understanding of how to build my food life, and it's really helped me. But being caught up on anything is not good.
Yeah. It's interesting because I was sort of getting a bit down on myself because of what I saw as weight regain, because the scales are saying that I'd regained weight. But I realised that being more active, doing more things, my clothes size wasn't going up, but my weight was. And I've realised that, I'm gaining some muscle.
Yeah.
And that doesn't show up so much in your clothing sizes and all that. So I fully believe that the reason for a couple of kilos of regain is because I've been building muscle.
Is because you're out there enjoying your life.
Yeah, but if I only looked at the numbers, then
Cry.
it's cry time, and I've wrecked everything. But it's not all just black and white like that.
No, it's not. It can feel very much that way, though. In those first 12 months, it feels very, very much that way. But as we walk the journey out and we become further and further down the track, I don't know, well, I've realised that it is really, really not a black and white thing. And learning how to walk this out is as individual as we all are.
Yeah.
And what works for me won't necessarily work for somebody else, but I really hope that everybody finds what is going to be a good fit for them.
Amazing.
Yeah.
Thank you so much for joining us this week.
Yeah, thank you guys. You're incredible. We really appreciate you. Thank you for listening.
We've been getting some emails, and it's just really nice to see that this podcast is making a difference.
It means a lot to us.
Yeah.
Like we said, it has been a really, really hard time for us over the last couple of months, and we don't know exactly how things are playing out at the moment. So there's been a lot of unknowns, but it's been really lovely to know that you're there. Yeah. So thank you.
Yeah. Have a great week.
And we'll talk again soon.